Hamon pa rin para sa maraming mga immigrant sa Canada ang makakuha ng trabahong batay sa kanilang degree mula sa bansang pinanggalingan o baong work experience at background. Kasama natin ngayong araw si Dr. Carla Hilario, Assistant Professor mula sa School of Nursing ng UBC Okanagan at may akda ng research na tumalakay sa pagiging de-skilled ng immigrants at ang epekto nito sa kanilang mga anak. So, Dr. Carla, if you can just, before we go ahead with the questions, can you just please share what the research is all about and what's the purpose of doing this research?
Oh, thank you, Paula. And thank you for the opportunity to share about this particular research on experiences of newcomer youth in Canada specifically around mental health and looking at mental health, not just as mental illness and diagnosed mental orders, but looking at mental health and well-being from a broader lens. I interviewed 33 young men. And so this was also specific to young men who were immigrants or refugees and were living in British Columbia at the time to ask them about how they perceived mental health and mental health needs. Living the Immigrant Dream spoke about what it was actually like to be in Canada, some of the challenges that they face, and then starting again from way below. These were all connected, and starting again from way below referred to experiences that many youth spoke about having to start again, start over in Canada, and they described that in various ways. But what I'll speak to today is starting again, not just for themselves as a family in terms of moving to a new place and getting used to, a new place geographically, socially, politically, but also for their parents specifically to have to start over again and being able to provide for their families, for their children.
What did we find out, when these young men witness how their parents, how their immigrant parents had to start over in Canada, seeing them working jobs that are not matched with the credentials, the background, the level of education and experience that they have back from where their home country, for example, Philippines. How does that affect or impact the children's mindset or future as they go along and start their own lives in Canada?
That's such a great question. And even today, even though it's been years since I conducted these interviews, I'm particularly struck by what several of these youth had shared with me, including one person, who said that they felt like they really had to perform very well in school, really, succeed because of the sacrifices the parents made for them, because the parents weren't able to work in the jobs that they, because their education wasn't recognized, and they, in the words of the participants, parents sacrifice a lot to move. And then also another person talking about how he witnessed one parent not being able to find employment and how that really led to depression in that parent, to mental health challenges. And we know employment is a social determinant of health. There's specific research in Canada with Filipino youth specifically, looking at social mobility between generations, and that research actually showed that the educational attainment of subsequent generation Filipino youth is lower than their parents. So the second generation does not achieve the same educational level as their parents, as the previous generation, which is only concerning because it is not the same pattern that is seen in other immigrant groups in Canada from other backgrounds. Typically, you would see an upward mobility or the same.
We've mentioned a couple of times already that you did this research 2018. Why is it important that we keep having these conversations, kind of reminding ourselves, our audience, the Filipino community, which is growing in Canada, that there is this research, there is this discussion. Why is it concerning? Why is it important that we continue to have these discussions?
Mm-hmm. Yeah, and Paul, I want to commend you on raising this topic because it is still relevant. And this topic has a very clear impact on people's lives. We are hearing the voices of youth in terms of, and this is one channel, right? This is a research project, but we hear people's voices in many other ways, and we hear the impacts of certain practices or certain circumstances, conditions in Canada that shape health outcomes. And I have to position myself here as a health researcher and recognizing these things like de-skilling and overqualification in positions, underemployment, as well as unemployment, as so tied to health, and we call them social determinants. When we think about the ways that Filipinos move to Canada, and I believe that this area needs to be explored more in terms of what it means for health and social care and services and programs, but also in terms of how Filipinos can further engage in discussions, including policy discussions. It's an important conversation to keep having because these trajectories shift and new policies are introduced. And it's important to know whether things are getting better.
Well, thank you so much, Dr. Carla Hilario, for sharing these very um, relevant discussion with us and for providing your insights and for sharing your research with us today.
Thank you very much. It was a pleasure.